Then, how many of you have access to a sauna, a gym sauna, maybe a spa? Good, because what I'm about to show you, it will change how you think about the sauna, not as a luxury, but as one of the most powerful cardiovascular interventions in medicine. The evidence is stunning. This is from peer reviewed data from over 20 years of Finnish research, not opinion science. This presentation is for educational purpose. Everything is based on peer review, research, and clinical trials. But if you have heart disease, take medications, or have cardiac condition, discuss sauna use with your cardiologist first. Individual responses vary. Safety matters. Your doctor needs to know your history. Why? It shows maturity and respect for shared decision making. Their credibility carries through the entire presentation. Today's topics. Here's the plan. First, what happens to your heart and blood vessels during a sauna section? The acute story. Then, 20 years cohort studies from Finland, long-term mortality data. Then, we compare Finnish versus infrared sauna, different options for different patients. Then, safety, what works, what does not, and which medication matter. Finally, practical guidance, protocols you can use Monday morning. This scaffold knowledge, each section built on the last. Acute hemodynamics effect. A Finnish sauna at 80 to 90 degrees Celsius for 20 to 30 minutes produce cardiovascular stress similar to a moderate jog. Heart rate climbs to 100 to 150. But here is the critical difference. When you run, muscles demand oxygen. Blood vessels constrict to maintain pressure. Your heart works hard against resistance. When you sauna, core temperature rises, your nervous system says, dump that heat, it's too hot. So vessels dilate massively, heart rate climbs, but with less afterload, less resistance. Cardiovascular exercise without the strain. That is why it is safe even in heart failure therapeutic, actually. Sweating rate is around 0.6 to 1 kilogram per hour. Blood pressure response. Blood pressure shows a biphasic response. Early phase, systolic blood pressure might transiently rise, which is a reflex from heat and sympathetic activation, but quickly, as vasodilation kicks in, both systolic and diastolic fall. This benefit persists, not a temporary blip. The number that matters, a single 30-minute sauna reduced systolic blood pressure from 137 to 130, a 7-point drop, and a diastolic from 82 to 75, another 7-point drop. How much do first-line blood pressure drugs drop pressure? Usually 7 to 10 points. We're comparing sauna to medication with zero side effects. In coronary artery disease patients, even more impressive. Systolic blood pressure drops around 19 points and flow mediated dilation improves 1.21%. That 1% improvement predicts future cardiac events. Arrhythmia risk. This is the question I get asked the most. Will sauna trigger arrhythmia? The honest answer from the evidence is no. The highest risk population for arrhythmia is chronic heart failure, damaged heart, reduced ejection fraction, vulnerable to dysrhythmia. If sauna triggers problems, we would see it first in these patients, but we do not. When research exposed heart failure patients to Finnish sauna, they found no excessive adrenergic activity, no complex arrhythmia, autonomic response identical to healthy controls. Finland has 3 million regular sauna users. If sauna caused sudden death, The healthcare system would have sounded the alarm decades ago. Instead, frequent sauna users have lower rate of sudden cardiac death. So when your patient asks, "Is sauna safe for my heart?" answer with confidence. For stable heart disease, absolutely, the evidence is rock solid. But as everything, always ask your cardiologist before you go into the sauna. The Acute HD landmark study. This is the slide that changed how I think about sauna. Acute ischemic heart disease cohort, 2,300 middle-aged men, 21-year follow-up, prospective, rigorous, men's sauna 4 to 7 times a week versus once a week, sudden cardiac death, a hazard ratio of 0.37, that is 63% reduction, 63% fatal coronary heart disease, hazard ratio of 0.48, which 52% reduction of fatal cardiovascular disease, a hazard ratio of 0.24, 76% reduction, nearly 3/4 less likely to die. All-cause mortality, 40% lower. How many medications do you prescribe that give 76% reduction in fatal cardiovascular disease? This benefit persists after adjusting for age, blood pressure, smoking, diabetes, cholesterol, and physical activity. This is independent of conventional risk factors. Clear dose-response relationship. More frequent equals greater protection. The mechanism. 6 complementary pathway endothelial function. The innermost arterial lining manufactures nitric oxide. Sauna increase shear stress, triggering more nitric oxide production. More nitric oxide means anti-plaque, anti-clot, anti-inflammation. Second, arterial stiffness. Sauna reverses arterial stiffness via heat-induced vasodilation, stretching the arterial walls, stimulating elastin and collagen production. Stiffer arteries predict heart attack. Sauna improves compliance. Third, autonomic balance. Shift you toward parasympathetic dominance, calmer nervous system, lower resting heart rate, better HRV, which is cardioprotective. Fourth, heat shock proteins. Heat triggers HSP70 and HSP27 production. Cellular bodyguards protecting against stress, reducing inflammation, enhancing repair. Fifth, inflammatory markers. Reduce C-reactive protein, improve lipid profile, reduce oxidative stress, and anti-atherogenic. 6. Blood pressure. Sustained reduction, one of the most powerful interventions in preventive cardiology. 6 mechanisms all synergistic. That is why outcomes are so robust. Finnish versus infrared sauna. Finnish sauna, 70 to 100 degrees Celsius with dry heat. Core temperature rises 0.4 degrees. Greater physiological stress, more robust autonomic response, a stronger mortality benefit in studies for whom healthy, fit individuals with normal cardiac function and good heat tolerance. Infrared sauna, 40 to 65 degrees. It's direct tissue heating. Core temperature rise nearly zero. Minimal physiological stress. Gentler option, still effective. Upregulates cytoprotective genes, NOS3, enhances endothelial function for whom frail patients, elderly, reduced cardiac reserve, heart failure, anyone unable to tolerate extreme heat. When research compared hot water immersion, Finnish and infrared, only hot water triggered significant inflammatory markers. Finnish induced control inflammation, healthy stress. Infrared, anti-inflammatory, no stress. Choice depends on your patient fitness levels and cardiac status. You now have 2 evidence-based options, precision medicine. Wow therapy. One therapy, Japanese for mild sauna, standardized infrared protocol for heart failure. Protocol 60 degrees Celsius, 50 minutes of infrared heat. Patients supine for comfort and safety, then 30 minutes passive recovery. Bed rest covered with a blanket to sustain effect. Frequency 3 to 5 times per week. Durations 2 to 4 weeks. Simple, deliverable, reproducible in any clinic. Evidence single center randomized controlled trial. 41 heart failure patients for 3 weeks. 6-minute walking proof. 337 to 339 meters. 42 meters gain. Highly significant. Flow mediated dilation improved. Endothelial improvement was the independent predictor of functional benefit. 1 CHF multicenter randomized controlled trial, 149 hospitalized advanced heart failure, and BMP of 777, improved New York Heart Class, 6-minute walk, cardiothoracic ratio, 0 serious adverse event, safe in decompensated heart failure. Patients on ACE ARB, spironolactone, had greater BMP reductions. 1 potentiates neurohormonal modulators, synergistic with guidelines-directed therapy. Bottom line, not replacement for GDMP, but excellent adjunct for motivated patients. Improves symptoms, reduces BMP, improves functional capacity. Safety and contraindications. Safe. Healthy adults, stable angina, prior MA greater than 6 months, compensated heart failure, stable coronary disease, common threat. Stability. If condition is stable, sauna is generally safe. Contraindicated, unstable angina, demand ischemia risk. Recent MI less than 6 months, rupture risk. Severe aortic stenosis, which has a fixed afterload, and vasodilation drops pressure dangerously. Severe orthostatic hypotension, active heat illness, medications, diuretic, fluid loss plus sweat, severe depletion, beta blockers, blunt heart rate response, impaired thermoregulation, calcium channel blockers, peripheral vasodilation plus heat is equal to profound hypotension, anticholinergic, prevent sweating, which lead to heat accumulates, tricyclics, SSRI, autonomic dysfunction, lithium, renal effects, compound dehydration. Review medication list before recommending. Alcohol, non-negotiable. Never recommend sauna with alcohol. Alcohol impairs sweating, cause vasodilation, suppress thermoregulation. Combined with heat, body cannot dissipate. It's very dangerous. Documented sudden death and arrhythmia from alcohol plus sauna. Be explicit. Can sauna or drink alcohol? Not together. Separate by hours. Exercise synergy. Sauna does not work in isolation. Combined with aerobic exercise, synergistic benefits emerge. Lee et al. Randomized controlled trial over 8 weeks. Exercise plus or minus 15 post-workout sauna. Sauna group achieved plus 2.7 milliliters per kilogram minimum extra cardiorespiratory fitness improvement. Minus 8 millimeters of mercury. Extra systolic blood pressure reduction, better cholesterol. A 15-minute post-workout sauna amplifies work benefits. Why? Sauna further enhances vasodilation, increased nitric oxide production, prolongs anti-inflammatory window. Exercise creates stacking mechanism. Key age cohort 26-year height fitness plus frequent sauna 3 to 7 per week. Cardiovascular mortality hazard ratio 0.42, 58% reduction. All-cause mortality HR 0.6, 40%. The strongest protection in entire study. Exercise alone is good. Sauna alone is good. Exercise plus sauna together. 1-2 punch. Tell patients if you're already exercising, hot sauna on workout days. Post-exercise sauna becomes recovery ritual, not extra burden. Multiple gains. Healthy adult protocol. For healthy patients without cardiac disease, traditional Finnish sauna, temperature 79 to 90 degrees Celsius, a duration of 20 to 30 minutes per session, frequency of 4 to 7 times weekly. Ideally, frequency 4 to 7 times weekly, ideally 6 to 7 for optimal benefit. Why this number? The key IHD protocol produced 76% reduction in fatal cardiovascular disease, with dose response sweet spot. Flexibility assists, cannot fit 7 times a week. 4 is protective, 6 is better, 5 is solid. Linear dose response, more equal graded protection. Talk to patient. Think of sauna as part of cardiovascular maintenance plan, like taking statin or exercising. Just 20 to 30 minutes, 4 to 7 times a week. Data shows 63% reduction in sudden cardiac death. Bundle it with something already doing, gym, then sauna, or morning ritual before work, or evening wind down. Make it a habit, not a chore. When routine, you stick practical advice. Stay hydrated, drink water before and after, eat something light beforehand, avoid alcohol completely. Sauna plus alcohol equals danger. Sauna alone, safe and powerful. Stable cardiovascular disease and heart failure. Stable cardiovascular disease, stable angina, prior MI, stable coronary disease, compensating heart failure. Finnish 79 to 90 degrees for 20 to 30 minutes, 3 to 4 times weekly. Conservative for stable disease. Still protective for key IHD, more manageable. Safety, excellent. What to expect? Short-term randomized control show modest vascular gain, but long-term data support benefit. Patient feel better, improve mood, reduce pain, better sleep. You have stable heart disease. Sauna is safe. Evidence for dramatic outcomes is strongest in healthy people, but no evidence of harm in you. Many reports better quality of life. Let us try 4 weeks trial. Heart failure 1, infrared 60 degree, 15 minutes, heat supine 30 minutes, recover under blanket 3 to 5 times a weekly for 2 to 4 weeks. Expect better exercise tolerance, longer walks, lower BNP, reduced cardiothoracic ratio, better New York Heart Association class, less dyspnea, excellent safety. We are adding one to guidelines-directed therapy, gently than traditional sauna. 15 minutes gently heat, then rest. Good data shows better exercise and more efficacy in heart function. Key takeaway points. 7 things to remember. 1. Strong epidemiological support for cardiovascular and all-cause mortality reduction. Key HD level data. 21 years, 2,300 men, 76% risk reduction. 2. Acute effects are favorable and immeasurable. FMD improves, arterial stiffness decreases, blood pressure drops 7 millimeters of mercury, equivalent to first-line antihypertensive. 3. Finnish 4 to 7 times weekly, optimal, infrared safer for vulnerable. Choose based on fitness and cardiac status. 4. 1. Therapy improve heart failure symptoms, function, capacity. Biomarkers with excellent safety, immediately prescribable. 5. Combine with aerobic exercise for synergistic benefit. High fitness plus frequent sauna equals greater protection. 6. Safe in stable cardiac conditions. Absolute contraindications, unstable angina, recent MI, severe aortic stenosis. Always review medications. 7. Alcohol is forbidden. Never recommend sauna with alcohol. Documented death. Be explicit in counseling. Regular sauna bathing, whether traditional Finnish or infrared, represents a safe, evidence-based, and enjoyable adjunct to conventional cardiovascular risk reduction strategies. Level 1 evidence from 21-year prospective cohort, not preliminary, gold standard in epidemiology. Sauna is not a replacement for medication, exercise, healthy eating, smoking cessation. Not saying skip statin and sauna instead. Malpractice. What we are saying for motivated patients seeking safe, affordable, evidence-based cardiovascular intervention they can implement immediately, sauna absolutely deserves to be in conversation. Monday morning, consult your next patient with confidence, not gimmicks. Now wellness trend, tool backed by decades, Scandinavian research and multiple randomized controlled trials. Remember, always keep informed and read on your own to make sure you take optimal decisions for your patients and you.